Hi, Dr. Ray here with Pro Holistic Care. Today I want to talk to you a little bit about what to do if you're having jaw pain, also known as temporomandibular joint pain or TMJ pain, as you've probably heard it called, when you're home and you're trying to talk or eat or do any of the many things that you need to do with your jaw, and it's uncomfortable for you. So to know if this pain is coming from the TMJ, generally you're gonna have pain at the sides of the face, right here by the jaw. You can feel the jaw if you put your fingers right on the side of the face and open and close your mouth. If you're having pain in those areas, we have a few simple techniques you can do at home to try to alleviate some of that discomfort. So the very first thing that you can try is just doing some mobility with the jaw. So we are going to do some what are called glides with the jaw. So we're going to slide the jaw back and forth. Very simple. You're just going to take your chin and stretch one side to the other. I'm sure it looks kind of funny, but the goal is that we're moving the jaw back and forth. Sometimes when the muscles get really tight or the jaw gets locked up, just restoring some of that motion is really, really helpful. You can do, 3 sets of 10 total, see if that starts to get it moving a little bit. A lot of jaw pain is also connected to the neck because the nerves that come out of the neck, they go to the jaw, they help the muscles around the jaw function. So if our neck is acting up, our jaw can be feeling the pain. So I'm going to show you how to do chin tucks. I'm going to show you how to do them the right way. When we say chin tucks, a lot of people think we're talking about tucking our chin down, but we're really not. We actually are gliding the skull on the neck. So I'm going to pull my hair to the side so you can see. A proper chin tuck, think about making a double chin and release. Tuck and release. Now, a lot of people want to go a little too far with this movement. They'll pull their neck really far back and then push it forward. We don't want to do that either because that can really strain the neck. So again, you want to come from neutral, back, relax, back, relax. That's going to start to take away some of the strain that's happening in the neck. In turn, that's going to relieve some of the pressure on the jaw. The last thing you can do on your own at home is some soft tissue work. You can look for those knots in the muscles. We call those trigger points. You can get knots in the muscles by the jaw, in the chin here, or also in the neck. So when you're having that kind of pain, I would take 2 fingers, feel the muscles in the face by the jaw. If you find a spot that feels tense or tender to the touch, you can just slowly, in small circles, move the fingers around and compress that area. And that's really going to start to alleviate the muscle. Work on it for about 30 seconds in each spot. Check both sides of the jaw. Check the back of the neck on each side. And work on each spot that you find for at least 30 to 40 seconds. Try those 3 things. See if you can get yourself some relief.